Just get started. Thank you so much for joining me on the Diabetic Debrief podcast. So, if
Yeah.
you can just start by telling me a little bit about yourself and just the type of diabetic care that you practice.
Yeah. So my name is Kelly Six. I'm a dietitian and a diabetes educator. I have been working in the diabetes world for maybe like 4 or 5 years now, and I've had diabetes myself for like 30 plus or so. Um, and I work primarily in the eating disorder field of diabetes. So this could be anywhere from someone who's struggling with feeding themselves and not feeling shame about it to someone who is engaging in like diagnosable disordered eating and eating disorder practices
Okay. That
at the outpatient level, which means that they just get to see me once a week or so and don't need additional care than that.
perfect. Okay, that's very interesting. And you said that you were diagnosed with type 1 diabetes yourself. Do you want to talk a little bit about like maybe how that inspired you, if it did, to get involved in like what you work in now?
Sure. Yeah, I actually, when I was growing up, wanted nothing to do with diabetes. And when people would ask me or like recommend that I become a nurse or a doctor or a dietitian, I would get so angry because I did not want it to define me or define what my passions were. Um, so I wanted to go into social work, and I wanted specifically to be working with kids and families. So I had a lot of jobs working with kids and families in schools. And I started taking classes about child development, and some of those classes included nutrition. And I remember being like, oh, I hate that I love this so much. And I hate that like this is what's happening. But you just like having diabetes, you know so much about food and you know so much about like talking about bodies and focusing on food and health and bodies that it like comes very natural, learning about it in an academic setting. So I just started like collecting um classes until it was like, okay, well, I guess this is happening. I guess I'm going into diabetes care. And at that point, I was like, yeah, this feels right. But it was definitely like a push and pull moment
Yeah.
with my relationship with diabetes.
I totally relate to the part of like not wanting to be associated with diabetes.
Uh-huh.
I
Yeah.
think like at the start of diagnosis, I think everybody probably feels that way a little bit. But
Mhm.
yeah, okay, so that tells us a lot about like I guess why you're interested in the work that you do and why you do that. Could you tell us a little bit more about like the type of people that you work with and
Mhm.
maybe
Yeah.
why you think that they are ending up like in your care?
Yeah. I work, so I know I started out saying that I started with kids, but I work only with adults at this point. And I work specifically in like a niche or like what I think should be normal of a weight neutral care. And so that means that we're not focusing on weight loss or weight gain, right? The body's going to do what it does as we take care of it. Um, that being said, that means that I work with people with a wide range of body sizes, and that feels very important as a part as to be centered in my work. A lot of people in larger bodies don't have access to good care because the first recommendation that they get is to lose weight, and they don't get any information beyond that. So I'm working with adults, often in larger bodies, and interestingly, often people who have had an eating disorder previously and then were diagnosed with diabetes, and it like messed with their recovery a lot because suddenly the things that they've learned around food, freedom, and permission are not the things that we're taught around diabetes education now. So it throws them off
Yeah.
a little bit, and so they come to me.
I can totally see that because diabetes, I mean, so you're saying that maybe you work with people who are like diagnosed later in life and they've already had like a lot of experience with and maybe trauma with food already.
Yes, yeah, definitely food trauma, and then coming back into a highly traumatizing environment that is the diabetes care world.
Yeah, I can see how that could be very like hard to deal with because food is definitely like a big deal with diabetes and you have to think about
Totally.
it all the time. Yeah.
Yeah. Yeah.
Yeah. So, okay, you have already kind of touched on this like a little bit when you were just talking about who you're working with, but could you talk about like current issues that you see in the healthcare system and I guess in diabetes care in general, and
Mhm.
how they're affecting the people that you are working with?
Yeah. Um, I think just because of the world that we live in, right? There's like such a uh pull towards like thinness and focusing on weight. That when you are a human entering the diabetes environment, that becomes really central and that's really hard, right? So a lot of focus on body. What is your body doing? What is your weight doing? There's this whole uh, BS around insulin and weight gain that is like so problematic and traumatizing. I wish that the people in the diabetes world, so our doctors, our dietitians, our nurses, had more education and experience on why that language is really harmful. Um, and why a lot of it is like not science-based and problematic, so that we're not starting off people early diagnosis in this place of really scary body fear and food fear.
I totally agree.
Yeah. Yeah. I'm curious what you thought. How are you relating to this?
Yeah, I mean, I think that I definitely agree with that. I think that's especially harmful for people who are diagnosed younger as well, because
Mhm.
it's kind of just instilled to you at a young age, and people with diabetes are diagnosed more so between the ages of like 0 and 18. So I can see how that could become a super big issue just for people like for the rest of their lives, even more
Mhm.
so, or like than like people who are getting diagnosed later in life. But then it's also a big problem for people who are diagnosed later because they've already had all these issues and then it just comes in and just
Yeah.
messes it up even more. So
Right. Yeah. As a kid, especially like that's when your brain is developing and your like all of your strong neural pathways are being created. And when these like when we're really normalizing like restriction and body control, that becomes like very central to our beliefs and it's harder to break out of that. Totally. Yeah.
yes. Yes, I totally agree with that. And could you talk a little bit more around you were talking about the stigma with like insulin and weight loss? Do you want to just like clarify that a little bit?
Yeah, so insulin, which I'm sure this is like so obvious to you, but I'll just start I'll start my little spiel. Insulin is a hormone of nourishment. And so our bodies, people without diabetes, when they eat, their bodies release insulin as a way of telling the body, like, oh, there's nourishment coming in, get ready. And the insulin causes our body cells to store glucose, uh, to store proteins, and to not break down our fats for energy. And all of this is normal, right? Like that's the signal that we want when we're fed is, hey, energy is coming in, use it, store it. Um, what happens there is if someone is not making enough insulin, so in type 1 diabetes, where early on not making enough and then later not making any, not having that hormone of nourishment can cause someone to lose a lot of weight because the body is not getting the signals that it's time to turn on all of our processes to save and use our energy, our nourishment that's coming in. So people can be in early diagnosis losing weight when they start on insulin. They thankfully gain that weight back because they're being re-nourished. And that's wonderful and excellent and great. And we want that. And when I hear about that talked about clinically, it's almost used as a warning. So you will gain weight and you should be very careful about that and really watch, we should be watching your weight, and insulin causes weight gain. And all those things are really scary in our very anti-large body world, which they shouldn't be. but it creates this, like, it can create for people this dynamic, this relationship with insulin of it being scary, when it's, we want those side effects.
Yeah.
We want to be nourished. We want, that's why we use insulin, right? Yeah.
Yeah, and
Does that answer the question? Does that feel?
totally. Like weight gain is a sign that your body is
Mhm.
healing and that your insulin is working. And
Yeah,
I don't
yeah.
think that's at all what we want to push. And that's super important. I did not know that. I mean, I don't think in my experience it was talked about like that, which I'm very
Mhm.
grateful for, but I can
Mhm.
totally see it being happening in so many other instances.
Yeah.
Yes.
Yeah.
Yeah. And then, okay, my last question for you is I know that you've also already talked about this, but what solutions do you see in the future? What change do you want to see? Like what large systemic difference do you think needs to happen for better like quality of life for your type 1 diabetic patients that you treat?
Mhm. Yeah. I think like on like a really like large scale is like we need to be talking about size stigma and weight stigma, and how that relates specifically to diabetes, and fear of weight gain, fear of food, kind of these like bigger like diet culture issues that we're kind of living with. I think on more of a systemic level, if we can get more education to the providers and have them really take this seriously, that this is like people, like an actual issue that people are facing, and it's a big deal to be using this language. Um, and then I think this is like, this feels kind of stupid, but like there needs to be more money. There needs to be more money for good quality care. A lot of people can't see providers that are well trained because they have to pay out of pocket. And so I think if we can get more coverage for people, that would be super cool. I don't know how to fix that problem, but
No, I think
definitely
that's
think about.
yeah. I think that a lot of people would agree with that. But I think that what you're saying about mental health and really considering that when talking about type 1 diabetes is super important, just especially because of how type 1 diabetes is a chronic disease. So like
Mhm.
people are gonna have to deal with this for the rest of their lives. It's not like something that you have and then you treat and then it goes away. It's
Totally.
something that you have to live with. And if we don't talk about like the mental side effects that come with living with diabetes forever and then also having to think about food in this way forever, I think it can have such a negative impact on like a lot of people's lives, especially if they start at a young age. Yeah.
Did you get that help when you were diagnosed?
I think that my family was very helpful in saying like, especially when we were starting like eating everything just like in moderation, just trying to like keep my blood sugar down initially and then slowly gaining the freedom to kind of like um
Mhm.
do what I want like as I kind of age.
Wow.
Yes, exactly.
Yeah.
So I'm very grateful to have that opportunity, but I also understand obviously not everyone does, and we need to like work towards making that better. Yeah.
Like, yeah, it should be kind of like a part of the package.
Yes. Um,
Mhm.
yeah.
I agree.
Yes. Do you have anything else that you want to say, or do you think that we can just wrap up now?
I think this is awesome that you're doing this. I'm really excited to see where you take this and who else you talk to. It's really exciting, Karina.
Yeah, thank you so much. Okay.
Absolutely. Yeah.